one of the problems with the current healthcare system that is very expensive is that it's reactive, that it's visit-based, that we don't see a lot of people apart from the time that they spend with their physicians. And David, Kevin, and Ralph Miller wrote a nice piece about this, calling for automated hovering. There are a number of other terms for this that you may have heard: mobile health, telehealth, health, connected health, etc. There's a bit of a bubble going on. The thing that I'm interested in here is mechanisms through which we gather data of people's activity outside of the time that they are with their physician. Importantly, I think the paper says, well, if people don't like these types of interventions, they can always opt out, right? That's a good way of addressing ethical issues around coercion, if you're just saying, well, you don't have to do this. And what does it mean not to let people opt out? Well, it can be a financial penalty, or it could be something like the Aetna case that I mentioned to you, where people say you don't get this resource anymore that arguably deprives possibly somebody else of using it. So as long as there's clinical utility, as long as there's data privacy, opportunity of choice, which means that people can reasonably accomplish the goal, and we have a severe health condition that has cost implications, it might be appropriate. So these are cases where I think it can be acceptable. Asthma, sleep apnea, chronic heart failure are maybe prime candidates, but I'd be interested to hear if you have other ones. On medication adherence in particular, there is a question that often people have good reasons for not taking medications, as we've also heard throughout this meeting. Now, it strikes me that when you routinely collect these data, a good way of dealing with this might be to say, well, if you don't want to use it now, just tell us why, because we're actually really genuinely interested in why. So this could broaden your understanding of why people don't use medications in particular circumstances. So this is the framework. The top 3 bullet points just summarize what I've just said, and the yellow bits are where I'd be very interested in your feedback. What do you think are best examples where people should be discouraged from opting out? What are borderline cases where maybe yes, maybe no, and what are cases where we really do want people to have an opportunity to opt out? And is this idea about provider responsibility is just some pie in the sky, or is that maybe something we should really be thinking about more? Is it something that could actually be actionable? Would it help if you have on your new mobile, on your new Apple Watch, a button that says, please transmit all my activity to the trusted third-party data pool for all good researchers in the world who will find out interesting things about physical activity?